Hi, my name is Dr. Simon Moore.
And I'm Dr. Paul Dillon.
We're from the review course in Family Medicine, but every month we release CFP Distilled. What is CFP Distilled?
Every month, a quick summary, 2 to 3 minutes of every important article in the CFP Journal.
And now that it's that time of year, it's time to reflect and spend time with family and enjoy festive things.
And study for the exam. So how can you review all of CFP Distilled? We put it all together every month's episode in one quick summary. Let's kick it off.
I just cannot fall asleep. If only there was a good article about treating insomnia in the elderly. And hey, guess what? There is in the January 2021 CFP Journal. We're here again with CFP Distilled. Every month, we take the top clinically relevant articles from the CFP Journal and distill them down for you. Other articles this month. There's one on other articles. What's that one? Yes, that's right. It's on memory impairment in the elderly, treating that using testosterone, and there's a third article we're going to summarize about topical tinea treatments for your toes. Paul, why don't you take it away and explain those articles to us?
You might be hearing questions from your patients, elderly males, about testosterone. Can it help with my memory? The answer is no, unfortunately not. It doesn't help with spatial visual memory improvement.
Managing insomnia in the elderly can be challenging. Brief CBT-style interviewing can help. 2 episodes can help up to 6 months after they're done. In addition, think about the P's, think about the partners in the bed, think about pain, think about pills that patients are on, and their physical environment. What's topical on toes and tinea pedis? A great article that looks at the evidence. Tea tree oil, likely ineffective. Topical terbinafine, slightly better. So 1 week treatment, topical terbinafine, otherwise topical azoles for 4 to 6 weeks.
That's it for the January 2021 CFP Distilled. Welcome to CFP Distilled, February 2021. We're going to talk about social prescribing and shuttering episodes in kids.
Social determinants of health can influence up to 80% of health outcomes. Great article on social prescribing. What do you actually do? So what can we do? A food box. Consider local food programs for your patients. What else do we have here? Grief and bereavement counseling. It's not just writing a card. Think about grief and bereavement groups. There's programs like Walk to Quit. Get those patients outside. Student senior isolation programs. Programs that nationally allow people to call our seniors at home and give them that social support. Finally, Food Fit. There's programs you can encourage your patients to go to where they cook, have a meal together, maybe even go to a gallery. So consider social prescribing real things that you can do to help your patients out.
So let's talk about shuttering episodes in kids. What are they? They're brief. They're tonic-clonic shaking of the head and upper extremities. Now let's see a demonstration. Come on, practice this. Well, I guess I'm on my own for the rest of it. Doesn't want to be a part of it anymore. So, what do we tell parents about shuttering attacks? We say this is not epilepsy. It's not going to lead to epilepsy later in life. There's a normal EEG. There's a normal neurologic exam. We don't need to do neuroimaging. So treating these kids, maybe a little bit of propranolol might help, but not always necessary. Reassurance and education. These are the mainstays of treatment for shuttering attacks in kids. That's it for CFP Distilled, February 2021. Welcome to CFP Distilled, March 2021. My name is Dr. Simon Moore, and along with Dr. Paul Dillon, this month we're going to talk about sport-related concussion, milk allergy, as well as diagnosing asthma.
Cow's milk protein allergy in children. We have to think about efficacy. We think about cost and taste test for those picky infants. What are the 4 different types of formulas that we can use that we need to balance those pros and cons? There's amino acid-based formulas. There's soy-based formulas, rice-based formulas, and completely hydrolyzed milk protein formulas as well. Read the article to find out what the pros and cons are.
How do we help those patients who they've got asthma but the spirometry was normal? It looks like they've got asthma, smells like asthma, tastes like they've got asthma. They've got a cough, it's unexplained, the spirometry was normal. Turns out spirometry in asthma is only 29% sensitive according to this month's CFP Journal article. Now, how do we help these patients? We send them for a methacholine challenge. 1/3 of patients with asthma symptoms and a normal spirometry are going to be positive on their methacholine challenge.
Sport-related concussion management. Is there something that we have been missing? Adding the PHQ-9, another validated score in addition to the STAT-5, can improve your pickup of depression in these patients. This is something we've been missing in the past. Add it to your arsenal.
Thank you so much for watching CFP Distilled March 2021. Check out our website at cfpdistilled.com and find out what's coming next with regards to our upcoming conferences. Welcome to CFP Distilled April 2021. My name is Dr. Simon Moore.
And I'm Dr. Paul Dillon.
So we're going to dive in and look at the top articles from this month, such as male factor infertility,
some of the top articles of the past year,
and we're going to find out the answer to that age-old question, glue, can we use it on the face?
An absolutely wonderful article about male infertility in this month's CFP Distilled. Breaks it down into the key aspects of physical exam and then the history. What are you going to watch for on physical exam? Is there a varicocele? The size and consistency of the testicles. Some of the unique syndromes you might want to wonder and think about. Cartaginer syndrome, Kallman syndrome. And why do I have not one, but two sample cups? You're going to want to get two properly collected samples of semen in your patients. And remember, pro tip, let the patients know the edges can be a little bit sharp.
So can we use gabapentin to treat alcohol use disorder? It's effective. It reduces heavy drinking days down from 27% down to 9% when you compare with placebo. But it is now second line and it is off-label. And here's why. There's a risk of diversion and it also doubles mortality. Now, alcohol use also increases mortality, so you've got to weigh the risks and the benefits.
Our next article in this month's CFP Distilled covers the top articles in 2020 as deemed by the peer group.
So one of the articles talks about compression stockings. Do they prevent cellulitis? The answer is yes. In fact, they had to stop the study early. They were shown to be so effective with so few complications. Number needed to treat was 4.
Another study that they highlighted was a changer. In the emergency department, we give a pink lady. It's a combination of viscous lidocaine and antacid. Studies showed you don't need to give both. Antacid alone. The antacid alone is enough without the harmful effects and the horrible taste of lidocaine.
So all the other articles covered in this peer group article, we hit them all at Vital FM Update, our family medicine conference. Check it out if you haven't yet at vitalfmupdate.com. Skin glue is back to fill the crack. A great article this month in the CFP Journal about closing lacerations in kids.
Game changer for me is the article talked about outcomes in using skin glue on pediatric lip lacerations. 3 blinded plastic surgeons couldn't tell the difference, so consider using it on pediatric lip lacerations.
The article tells us exactly when it's okay to use skin glue. So first of all, the edges need to be touching. If they're well opposed, you can use the glue. As well, the length of the laceration should be 1 to 4 centimeters, depth 4 to 8.
Great numbers to remember. Tips on skin glue.
What are the top CFP Journal articles in this month's CFP Journal? May 2021, we've got articles on bisphosphonates, vaccine hesitancy, a fatal case of nitrofurantoin toxicity, and neuropathic pain.
Let's talk about osteoporosis in postmenopausal women. Denosumab and bisphosphonates. An article comparing the two. How do they compare? They're basically the same, with most causing a decrease in 3 to 5% in vertebral fractures. Now, what about after 5 years? Well, evidence then gets a bit weaker, but denosumab and bisphosphonates in postmenopausal women, basically the same.
So how can we help our patients who are hesitant with vaccines? The evidence shows, including the Cochrane review, that if we do it poorly, we can actually increase hesitancy. So how do we have these conversations? A study with patients about the HPV vaccine showed we can actually increase vaccine uptake by up to 46% if we do 2 things. Number 1, motivational interviewing, and number 2, combine that with presumptive language. What's presumptive language? It's saying statements like, we're going to be giving vaccinations today. Those kinds of statements, combined with empathy and tailoring it to the clinical situation, can help your patients improve vaccination uptake rates.
Oh, this patient might need some nitrofurantoin. First line for UTIs, cystitis, But some people are on it longer term for prevention. What are we concerned about in those patients? We're worried about peripheral neuropathy, lung toxicity, but a less common side effect is liver toxicity. So consider in patients who are on it for long-term use, check their liver enzymes after a month and then every 3 months after that. Cheers.
Another fantastic tool from the peer group. They've always got these amazing resources that we take clinical evidence and summarize it at the bedside. And this month's is on neuropathic pain. It shows which drugs are most effective. And so the summary: anticonvulsants, SNRIs, rubefacin, such as topical capsaicin, and opioids, not quite as great. But summarizing it down into a happy face diagram makes it really easy to summarize and explain to your patients. So that's it for CFP Distilled for May 2021. Please hit like or subscribe if this was helpful. Also, if you're preparing for the CCFP exam, check out the resources that thousands of people have used to help them succeed at thereviewcourse.com. The top clinical articles in the CFP Journal, June 2021.
Nosebleeds, what to know. Most common cause, digital trauma. Really common, 50% of kids by the age of 10 will have nosebleeds. Management, first step, digital pressure. Nasal hydration, nasal moisturizer. So there you have it. Pick your treatments, pick your investigations, and most importantly, don't pick your nose.
What do dermatologists do when the steroid doesn't work? Yes, I need a dermatology subspecialist. Oh yes, dermatology subspecialists specializing in the upper outer layer of the skin. Yes, the epidermatologist, just who I'm looking for. So I've got this patient and they've got a rash and I just can't get it to go away. What do I do now? Have you tried the everything cream? The one with an antibiotic and an anesthetic and a steroid all wrapped up in a propylene glycol base? Yes, that one. The one we tell GPs never to prescribe, right? Yes, that one. It's not going away, hey? Let's call another dermatologist.
So the everything cream is not working?
Yes. Yes!
Democritus was right. First, derm, no harm. Those are the 4 most common allergens.
Topical antibiotics, anesthetics, steroids, and propylene glycol. If the rash keeps getting worse, maybe the treatment is the cause.
So many controversies around iron dosing. Let's iron out the wrinkles and smooth out iron dosing. So what do? Do you give it every day or every other day dosing? Everyday dosing can give you higher numbers. Meanwhile, every other day dosing, less GI side effects. So there you have it. That's how you can raise your iron levels.
Hi, I'm Dr. Simon Moore. Welcome to July 2021 CFP Distilled. We're going to take the top clinically relevant articles from this month's CFP Journal and summarize them for you. When I see a patient in my clinic, sometimes I quickly realize that there's actually 2 people in front of me that need help. Caregiver burnout is a real challenge that we're seeing a lot more of these days. Here are 4 questions that I ask caregivers, and you can ask too, to find out how they're doing. On a scale of 1 to 10, how able are you to cope right now? Who helps you right now? Do you have a family doctor? Do you know where you can find crisis support services? What do you see in your future? Asking these questions can help me identify who's struggling. And if you see a friend who you think needs help, ask them, are you okay?
The bigger the bump, the bigger the risk. Excessive gestational weight gain is a big problem in North America. What are the risks? Risks for mom include increased risk of C-section, gestational diabetes, pregnancy-induced hypertension, thromboembolism, postpartum weight reduction, and long-term metabolic outcomes. Risk for baby include higher rates of spontaneous abortion and stillbirth, macrosomia, neonatal metabolic abnormalities, and childhood obesity. There are many barriers for success on both sides of the relationship between the primary care provider and the pregnant patient. Depending on their pre-pregnancy BMI, total weight gain should be between 5 to 12 kilograms for women. Studies show that only 1 in 3 women receive weight counseling support from their providers, so don't forget this important step.
So your child has swallowed a coin battery or a metal object. How do doctors know what to do? The rule of thumb is if it reaches the stomach, then it's likely to pass on its own. But if it's a button battery, these can dissolve within minutes and can burn a hole in the esophagus. So if they swallow a button battery, call 911 immediately. When you call 911, sometimes they recommend giving honey to a child who's just swallowed a button battery, as that can be protective. Magnets are a different story. A single magnet usually passes on its own. If multiple magnets are swallowed, though, they can get stuck together with some bowel wall between them, and that can cause damage to the guts. Something that's sharp on both ends is typically removed. Interestingly, when some things have a sharp point on one end and a dull point on the other, in some cases they'll pass through completely safe with the dull end leading and the sharp end trailing behind. Needless to say, the patient's symptoms always play a large role in the assessment of what to do next. So, in every case, check with your doctor.
So that's it. I hope you enjoyed this month's CFP Distilled.
The top clinically relevant articles in the August 2021 CFP Journal. Let's take a look. Can you list 2 major causes of skin diseases and their treatments when it comes to coronavirus disease? So the first one is caused by the virus itself. The August 2021 CFP Journal talks about these conditions. So specifically, there's livedo, there's pseudochilibanes, there's maculopapular lesions, and there's vesicular lesions. The whole separate category is the conditions that are caused indirectly. We're talking about things like maskne or irritation of your hands from using way too much soap and hand sanitizer. Can you think of 3 treatments for maskne? So number 1, benzoyl peroxide. Number 2, retinoids. And number 3, active ingredient wash.
There's one interesting article that deals with MIS-C. So are we missing anything with COVID-19 in children? Multisystem inflammatory syndrome in children, MIS-C. So it's something that shows up in kids who've had COVID-19, either confirmed or after symptoms, 2 to 6 weeks afterwards. And what is MIS-C? The multisystem inflammatory disorder, which can have fever associated with it, some cardiac symptoms, and even GI. So something to be aware of in patients who may have had a diagnosis of COVID-19. Now, do we have to be afraid of this? In some cases, it can have some severe complications. These are still rare. What patients are we more concerned about, or should we watch for? It's male patients around the age of 8, often with no other comorbidities. So it's a quick summary, great article in this month's CFP Distilled.
Improve the health of our Indigenous patients. This is a question asked in the August 2021 CFP Journal article on cancer and chronic disease screening. Now, I know not a lot of community clinicians and physicians have the resources that I have at the clinic where I work. So we've got Indigenous elders, Indigenous clinicians, we've got nurses, social workers, mental health support. So what can you do in a clinic that doesn't have all these things? Well, the article makes many suggestions about chronic disease, about systemic racism and overcoming these barriers. Here are 3 practical takeaways that I think most family doctors can do in your clinic. Number 1, provide educational information to your patients about screening, and even better, if you can, provide it in the patient's own language. This can be hard to get, so think about contacting your local Ministry of Health, your provincial or territorial medical association, the patient's own community, or your own cancer screening organizations where you are. Number 2, encourage your patients to have someone else present at the appointment, whether it be an older friend, a relative, an Indigenous elder if they want to bring them. Tell them that that's welcome at your clinic. And number 3, time. Your patient might not want to make a decision on the spot about mammography, colonoscopy, so the article suggests maybe giving a bit of extra time and saying, we can have this discussion at the next appointment if you so choose. Hi, my name is Dr. Simon Moore from the Review Course in Family Medicine and Vital FM Update. This is CFP Distilled, where every month we take the most clinically relevant articles from the CFP Journal and distill them down into an easy and bite-sized, memorable format. So, what are the articles that we need to know from the September 2021 CFP Distilled? Number 1, SGLT2 inhibitors, not just a diabetes drug. Number 2, testicular torsion in kids. And number 3, asthma, COPD, where do they overlap? Let's find out. So let's talk about the SGLT2 inhibitors. They're not just a diabetes drug anymore. There's cardio-renal protection for people with diabetes, and now the Canadian Cardiovascular Society guidelines say that everybody who has heart failure that's symptomatic with reduced ejection fraction should be on an SGLT2 inhibitor. So why is that? Well, here's the number needed to treat. If you have 100 patients and you put them on an SGLT2 inhibitor and follow them for a year and a half, 7 of them are going to say, I've had a better quality of life. 4 of them will avoid hospitalization, and you will save 2 lives, 2 fewer people will die. So now that we're going to be starting SGLT2 inhibitors on more patients at the cost of about $500 a year, what should we be telling our patients about this? There's 3 S's to know when you start an SGLT2 inhibitor. Number 1 is sugar, number 2 is sick day, and number 3 is it slows the kidneys. So sugar in your pee. This is how it actually works. It reduces your sugar in your blood by helping you pee it out. So if you're peeing out sugar, your sugar is going to be a very attractive place for yeast and bacteria to grow, and that's why sugar in your pee can increase the rates of urinary tract infections, balanitis, and yeast infections. So that's the first thing to warn your patients about. The second thing to warn your patients about is sick day management. Stop the SGLT2 when you're sick. If you become acutely ill or dehydrated, you want to stop the SGLT2 inhibitor, and you want to make sure you give written instructions to your patients so that they're aware of this need. And the third one, for patients who are on an SGLT2 inhibitor and they're just starting out, you might notice that it slows the kidneys. There might be a drop in the GFR. It's short, it's transient, it's usually about 4, and in fact, you don't even need to do anything about it. It's totally reasonable to just observe. Unless it drops more than 30, that's when you should act. So that's why SGLT2 inhibitors are being used for patients with heart failure, and 3 S's to remember when you start a patient on an SGLT2 inhibitor. Another very helpful article from the September 2021 CFP Journal is about testicular torsion. Now, a young lad comes into your clinic or emergency department, they've got scrotal pain, or maybe they've even got just abdominal pain. Do they have a torsion? Do they not? And you need to know this because there's major implications. In fact, this would be a great SAM question. What are 3 things that can happen if you miss a testicular torsion? So the answer from the article, number 1, reduced endocrine function. Number 2, infertility, and number 3, loss of the testicle. So how do we pick this up? How do we make it easy? Well, this article talks about the TWIST score, which is a fantastic tool you can use at the bedside to find out, does this patient have a torsion? Do they need further investigation, or do they not? Because a score of 0 essentially rules out a torsion, and it's been validated in kids. One final article from the September 2021 CFP Journal. It's about asthma, COPD, plus there's a third lung condition that looks like both of these that we need to know about in primary care. Now, we need to be able to distinguish between asthma and COPD, and there's long lists of criteria that help us point towards one or the other. One point that you may not have known is patients who have COPD usually have a history of smoking exposure, or instead of smoking, they might have been exposed occupationally to biomass fuels. So make sure you're taking a great occupational history. The other clinical pearl from this article you need to know about is this. Patients with newly diagnosed COPD need to have an alpha-1 antitrypsin test because we underdiagnose that condition. So what is this third condition we need to know about? It's called the asthma COPD overlap. It was proposed by the authors of the COPD Gold Guidelines and the China Asthma Guidelines, and they said there's a new condition in which it's not really easy to tell these two apart. So why is it important to know the difference between these and how to treat them? It's because treatment is different. Major changes in the 2021 guidelines show us that we need to be giving inhaled corticosteroids to our patients with asthma first line, not just a bronchodilator. So patients with asthma, patients with ACO need to get inhaled corticosteroids, but not all COPDers need that. So one final quiz question about this. Which patients with COPD benefit most from inhaled corticosteroids? These are the folks with a high level of blood eosinophil levels counts, and that's above 300, or patients with frequent or severe exacerbations. Those are the COPDers who are going to benefit most from an inhaled corticosteroid. When it comes to asthma and ACO, however, make sure all those patients are on an ICS first line. So that's it for the September 2021 CFP Distilled. Make sure if you're studying for the CCFP exam, check out the reviewcourse.com. We've got free exam tips, tricks, and strategies to help you succeed. Till next time, I'm Dr. Simon Moore. Take care. What a great autumn day for CFP Distilled October 2021. Let's take a look at the top clinically relevant articles in this month's CFP Journal. We've got lactational mastitis, COPD and asthma in the elderly, and everybody's favorite topic, atopic dermatitis, that is.
One really interesting article this month is about radiation dermatitis, something that we would see in family practice after many of our patients may have undergone this procedure and suffer some of the side effects. Some of the more common stuff is fatigue, just being really tired. So we want to screen these patients, check their thyroid levels, check their B12, but otherwise potentially even talk to them before they undergo this procedure to understand that this is quite common. So we've worked them up for that. What about some of the common skin conditions that can happen? We want to recommend some loose clothing. If there's minor irritation, 1% hydrocortisone. Remind your patients to avoid any sort of perfumes or chemicals that they might spray on. And what about those really sensitive areas? Some of them might have issues around sexual intimacy, so make sure to remember to ask and counsel your patients on those. For the perianal area, commonly will have side effects
from the radiation, that dermatitis in that really delicate area, recommend sitz baths and appropriate treatment. So there you have it, some quick tips on radiation dermatitis, something we're going to see more and more in our practice.
Lactational mastitis affects 30% of breastfeeding women. It is commonly caused by Staph aureus and other skin flora. Mild cases can be managed with frequent breast milk removal. More severe cases might need antibiotic treatment with a focus on Staph aureus bacteria. It is important to continue breastfeeding throughout your bout of mastitis.
COPD and asthma are common issues in our elderly patients. So how can we overcome the barriers to using the medications properly? Barriers like poor cognition or dexterity or weakness or vision issues. If we prescribe a smaller inhaler device, that has actually been shown to improve outcomes. Not only that, give a verbal and visual demonstration of how to use it.
A quick fix for those suffering from atopic dermatitis. Showers 1 or 2 times a day, cool water, no additives, no water softeners, can improve symptoms by 30% in 40% of patients. So there you have it. Quick showers 1 to 2 times a day can improve symptoms in those with atopic dermatitis. A really quick fix right now.
That's it for this month's CFP Distilled. I'm Dr. Simon Moore on behalf of myself and Dr. Paul Dillon. Please give a like or a subscribe if you found this useful. And if you're studying for the CCFP exam, do check out thereviewcourse.com. We've got you covered. What are the most clinically relevant articles in the November 2021 CFP Journal? Hi, I'm Dr. Simon Moore from the Review Course in Family Medicine. We're going to take a closer look at some of this month's most clinically relevant articles, including lung cancer, semaglutide for weight loss, children with cyclic vomiting syndrome, and screening for cancer in women who have sex with women. Let's take a look. Cyclic vomiting syndrome is a good condition to know because it affects 1 to 2% of kids, but it's often misdiagnosed. So if it comes up in your clinic or on a SAMP or in a SU, make sure you ask about family history. Up to half of the family history includes migraine headaches. Now, how do we manage the episodes? Minor episodes, sleep it off or treat them with some minor sedatives like anhydramine or chlorpromazine. More severe episodes need to be admitted to hospital for fluids and also for monitoring of electrolytes. Needless to say, this can be a severe impact on the quality of life of these patients, and so parents are going to ask you, how can we prevent it? In kids, data is extremely limited. Adults are often treated with amitriptyline or with topiramate. And in children, there are some small trials with a couple dozen kids that have shown promising results with either of those, though often kids drop out of those trials because of severe side effects.
What are the latest updates in lung cancer screening? There's some new tools out there, PLOCOM 2021, a risk calculator for lung cancer risk. But what are we doing in Canada? Consecutive CTs for 3 years for those who are at high risk. And who's high risk? Who are we screening? Those 55 to 75 years old using low dose CT. And why are we screening? We're trying to pick up those cancers that we can get early, because lung cancer accounts for 25% of mortality from cancers. So what can we do? We can pick up those cancers early and decrease mortality. Read the article in this month's CFP Journal.
Do semaglutide injections help reduce body weight? The Tools for Practice crew took a look at this in the November 2021 CFP Journal, and here's what they found. Injectable semaglutide, subcutaneous 2.4 milligrams a week, does help most people lose weight. About 70 to 80% of people will lose about 5% of their body weight or more. In fact, the average amount of weight lost is 10 to 15% of their body weight. They compared that with placebo. Placebo patients only lost 2 to 3% of their body weight in these RCTs. And this effect was spread out over 68 weeks in some of the longer trials. So, what's the cost and what's the downside? Turns out a lot of people have side effects, gastrointestinal side effects. We're talking 75% of people are going to feel gastrointestinal upset, but it's not severe enough that it makes them stop the medication, which is probably a good thing, seeing as how if they did stop the medication, they gain the weight back. There's not a lot of evidence when it comes to preventive screening in women who have sex with women, which is why there's a great article in the November 2021 CFP Journal which covers this topic. Issues such as cancer screening, diabetes, domestic violence, these issues are specifically mentioned and some common misperceptions are addressed. For example, common misperception, women who have sex with women don't need to have pap tests. Turns out that is false. They do have HPV. It rates up to 30% in one study. That's in lesbian and bisexual women. Another study found that women who have sex with women who report never having had heterosexual contact still have HPV rates up to 19%. So for that reason, do follow cervical cancer screening guidelines for your province and your patients who are women who have sex with women. Thanks for joining us for the November 2021 CFP Distilled. Please take a look at the reviewcourse.com if you are interested in monthly updates on family medicine topics, or if you've got a CCFP exam coming up, we're there to help you prepare. What are the articles you need to know from the CFP Journal this month? It's December 2021, and I'm Dr. Simon Moore from the Review Course in Family Medicine. It's CFP Distilled, where we break it down and show you what you need to know. Key pearls from this month. Number 1, IBS and CBT. Is there a role? Number 2, let's take a look at the latest and greatest guidelines that have come out for your clinical practice and things to know for the exam. And number 3, what do we need to know for migraines? Brand new treatments. Let's dive right in.
Is CBT effective in children for those who suffer from IBS? And the answer is yes. CBT, whether it's internet-directed or internet-based, has been shown to decrease pain along with improved outcomes. So consider CBT in children with IBS. Read more in the article in this month's CFP Journal.
There are so many guidelines constantly coming out, so how do you know which ones that you need to study or be aware of for your practice? Well, take a look at the December 2021 CFP Journal. There's a great summary of key pearls from guidelines that have recently come out. Let's take a look. For example, number 1, you need to be aware of the new terminology and the new management for heart failure. Systolic heart failure, don't use that term anymore. The new term is heart failure with reduced ejection fraction if the EF is less than 40%. Second key point from this article, esophageal adenocarcinoma. Those patients, even if they've got GERD, we do not screen them for esophageal adenocarcinoma according to the Task Force on Preventive Healthcare. And the third one, if you've got folks who are 65 years of age or older coming into your clinic, check their pulse. Find out, are they irregular? Do they have a heartbeat that suggests they might have atrial fibrillation? We should be screening all those patients according to the new CCS AFib guidelines. So how do you keep up to date with all the guidelines coming out? Better way to do it, go to thereviewcourse.com/guidelines. That's where we compile everything you need to know for clinical practice and for the CCFP exam.
And we use biologics for absolutely everything. Some recent studies have shown that even for migraines, if oral medications have failed, first line, second line, third line, there are some biologics that are calcitonin gene-related peptide inhibitors, CGRP, calcitonin gene-related peptide inhibitors. Another thing you can add to your arsenal to consider when dealing with chronic migraines.
That wraps up CFP Distilled for December 2021. If you're studying for the CCFP exam, please take a look at our work at thereviewcourse.com, where we help you prepare. And we would love to see you again in January for the next month edition of CFP Distilled. Wow, you made it to the end?
Amazing. Now sign up for the Review Course in Family Medicine, where we put it all together.
See you there.